welcome to this room. Vijayananda, good morning. Sonali, Dinesh, welcome again after a long time. Chirag, I don't know who is iPhone. Hi, Jainath, Maha, Gaurav. Okay, Sachi Prasad, Chandrasekhar, Rudresh, Sweta. And I hope you enjoyed this session. Okay. How are you feeling now? Is it okay?
Yeah,
Yeah, super. Hi, Gaurav. After a long time, I'm looking at your face with energetic movement. Okay, now I'm going to take some questions. After that, today I'll tell some secrets which are going to go happening in this health industry. So what you need to be taken care of. So before that, you have any question, I'll address them. Health questions, any problem you want to solve, I can give some suggestions. You know that everyone knows that, right? I'm a certified health coach now because now I saw many people are struggling in this and I know I can help them. So I did certification at the end of the September because now I'm working with some clients in resolving their health problems. If I solve the problems, then I'll get international certification after passing the exam, international exam. So I'm hoping for the good and I'm moving towards this route. Yeah, okay. Now you can ask. If you don't have any questions, then I'll move forward. Hi, Gaurav, please go ahead.
yeah. Some tips I need for sleeping early because sleeping pattern is like I'm sleeping very late. Even if after going to bed, I'm not getting sleep till 12:30. So that is one reason I couldn't join the 5:30 sessions. But yesterday also I slept that way, but I thought that someday I have to start. So I was missing on the thing. So what are the some tips which I can use for sleeping early actually?
Yeah, is anyone feeling like this same problem that soon after going into the bed, you're not falling into the sleep? Okay, Maha. Okay, you can raise
Not
your
all,
vertical.
yeah, not always. Sometimes I feel, yeah, when it's
Yeah,
stressful, I get to know that, yeah.
three things we have to keep it in mind for a good sleep. Like you can sleep like a baby. Okay, you everyone knows that we were doing Isha Kriya, right? Meditation for 10 to 15 minutes. Everyone knows this Isha Kriya. Maha, you know that?
Mm,
No?
Yes.
You can type in YouTube Isha Kriya or any other meditation. At least you have to do three times 10 minutes. That 10 minutes meditation morning, afternoon, and before sleep. If you do this three times for 40 days, you will feel sleep. This is the one thing. Second thing, before going into sleep, if you are going to 10 onto the bed at 10 o'clock, please avoid all the screenings. It's okay. Nothing is important than your health. Stop all the screenings. Your TV, your laptop, your mobile, all the lights. Make it dim in your after 7 o'clock. Make your entire room very less light, very dim. Because what happens is our circadian rhythm gets disturbed when we feel with all the lightings. What happens is our circadian rhythm maintains our body. It activates from the morning when sun rises, the rays come and it activates our body to not to sleep. At the same time, in the night before we sleep, it ensures that it will deactivate so that it will we will sleep. But what we do, we disturb our circadian rhythm by uh, seeing this mobiles, TVs. Even though on the bed also we always see the mobile, look at the mobile and sleep. Otherwise we don't live, right? That is our lifestyle we have changed into. So if you want to take care of your health, first of all you have to do these two major steps. One is meditation three times. Second one is only 10 minutes. 10 minutes can be doable and take out from your life every three times. And the second thing is even include your children also. Please tell them to stop doing the screening. Nowadays, with this screening, the children are developing a lot of mental issues. Okay. Then when you stop at least 2 hours before bed, then before going into your bed, read a book. Any book, it's okay. Any book for 10 to 15 minutes because you have already stopped your screening. Then you will sleep very superbly. I applied this and it is still I'm doing this. One is you please maintain this, whether 10 to 5 or 10 to 6 you are sleeping, it's okay, but do not fix this time, sleeping time. Yeah, it will not disturb your mind and your circadian rhythm also. If you maintain this time 10 to 5 or 9 to 4, whatever it is, minimum 6 hours of sleep, you fix that slot. Then what happens is after 10 days, after 1 month, even if you don't want, you will get up at that time. That is called circadian rhythm, body clock. It's called clock, biological clock. Okay, if you do these three things, and third one is maintain your proteins, carbohydrates, and fats in balance. This is called balanced diet. Sometimes because of the poor diet also, we fall not asleep. Okay, this is very important. Slowly we keep on talking about that, and I'll slowly indulge each and everything what is important in your life. Okay, and nowadays the problem is the adulteration of food, the outside food what we are eating, especially the packaged food like biscuits, chips, yeah, outside the junk food what we are eating, fries and all. These are all having trans fats. Trans fat, it doesn't mean the bad cholesterol. LDL, if you check your blood report, LDL, low density lipoprotein, which is called bad cholesterol. If it increases, it is called atherosclerosis. It increases the probability of heart attacks. So that is why please stop eating outside. If you want to eat anything same like that, please prepare at your home, because they are not changing the oil frequently. Second, they are using hydrogenated oil, which is trans fats. And third one is the oil with itself is having lifelong time. They are not throwing the old oil. They are renewing the oil by pouring water, and that is becomes refined oil. Even in your home also, if you are using refined oil, throw it out. Yeah, try to use wood pressed oil. Refined oil has trans fats, which is very much dangerous to your health. Okay, and we'll slowly speak, we'll discuss in our daily classes. If you have 10 to 15 more minutes, I'll tell a secret of why a lifestyle becomes increases overweight, how overweight is slowly developing cancer. I have time for 15 minutes. Guys, if you don't have any time, people can drop. People wants to know about this, please be in this room. For next 15 minutes, I'm going to talk about this, the major secret I'm going to talk about today, and you have to keep it in your mind, because no one talks about this. Because now I'm into this health coach journey, people are not talking about this. Not even doctors. Doctors do not bother what your health is. You go inside doctor's room, he will only 2 to 3 minutes, he will focus on you, he will keep on writing and send you out. Right? Okay. Are you ready? Is it okay, or let us conclude this session? Yeah, let us discuss. Super. If anyone wants to drop, you can drop. Next 15 minutes we are going to discuss, and I already spoke in the one of the sessions. Yeah, one more time I'm telling this, and in the next time I will tell another secret. So keep on discussing these things. First thing is how we are developing our overweight. Overweight is like we are eating food. So when we are eating food more than our calories, for example, every day if we need 2000 calories, for example, so all of a sudden some food, some watery food, sweets, or any food which is coming in our way, we are eating without control. Sometimes we binge eating while watching TVs or matches, or while we are typing, we keep some food aside and keep on eating. So we don't know how much it is going. So if it is reaching more than your calorie expectation, then your body will accept it. What happens is whenever you're eating food, any food, it rises your sugar, and it increases and it develops insulin. It is called hormone insulin, which helps in distributing these sugar levels into all your cells of your body. So this is the main purpose of insulin, to reduce your sugar levels in your body. How? When you are eating, sugar levels are rising up. So these sugars should be distributed in your all these cells of more than 70-80 trillion cells are there in our body. They should be distributing in all our body. Okay, that is one thing. So what happened? When we are eating more, the sugar levels are more, but the cells are not accepting them. What happened is this insulin will open the cell and tell the cell that please accept the sugars inside. So when it accepts, it will close again. So when it heats sufficient, it will not open again. So we are eating more, that additional sugars are not going inside the cell. So where is that going? This is going inside our body, right? So it becomes deposit. So when the sugar levels are inside blood are high, our brain senses that, wow, oh my God, the sugar levels are very high. What should I do? Then it gives a signal. Our body is perfectly artificial intelligence. Okay, it gives a signal to our blood that your sugar levels are too high in your blood. Please throw them in your nerve cells. If these are all, this is your nerves, yeah, blood nerves, which is carrying blood. It will tell that please throw blood in the walls of the nerve. Do not keep in your blood. Okay. So what happened is the sugar coatings are there on the walls of the nerves. That is called atherosclerosis, a building up of bad cholesterol in your body, right? So when this is building up, what happens? This flexible nerve is become very stiff, right? So how it should be like a flexible, now it becomes very stiff. So what happened? Before that it was flexible. This is the nerve, this is the wall. When it is blood is coming, before getting flexible, high, like before getting a very hard, the systolic and diastolic pressure, the blood pressure is very cool. Systolic, diastolic, systolic, diastolic. But because of the stiffness of the wall of the nerve, the systolic pressure is coming, hitting very hard and going. Systolic, diastolic, systolic, diastolic. So 120, 80 should be, it should be going 140, 90, 170, 100. So this is improving, increasing, spiking our BP. Are you understanding my point?
Yeah.
So what happened when it is increases our BP? So when we go to hospital, right? We go to hospital and we'll tell doctor my BP is high. Then he will pump and he will say, yes, your BP is high. So what he will do? He will directly write a tablet, BP 200 mg, right? So if anyone has BP, you can correlate with this. Well, I'm telling an example, 200 mg, it is not maybe 200, 100 or 50 maybe. So for example, 200 mg tablet is given. Your BP has gone down because what happened? Your heart is pumping, right? Very high. That's why it is pumping and it is receiving, pumping and systolic, diastolic. This is your heart. When you eat this BP tablet, it becomes slow. It means the BP is controlling your heart, not your pulse, right? So that is why your heart is becoming weak. That is why if any BP patient, if you see, he is the permanent patient for BP patient, heart patient, and he will be the permanent medicine inhaler. So again, you second day when you are it is reduced. When you eat food, again it will rise. When you eat food, your sugar levels again rise, and again your BP rise. Again you will go to doctor. Doctor, you gave me the tablet. It is not reduced. And again, what he will do? He will increase the dosage. Right? He will never decrease the dosage. He will increase the dosage. So what happened? Again, it controls. Yeah, it controls. So what is happening? This medicines are controlling your heart. It is weakening. They are weakening your heart. So it should be very taken care of. And if it is more increasing, what these tablets are doing, you know, that they are taking all the sugars and also some, I'll tell you about in the future, calciums. So all the things are getting, they are collecting and dumping in the all the organs, because the additional thing is there, right? Because now the cells are not opening, then the blood should not be having sugar inside the blood. The additional sugar, one is dumping in all the organs and in the muscles. That is how additional sugars are getting accumulated in the muscles and it is becoming fat. One thing is that. Second thing is, when your sugar levels are spiking, I told you one hormone, insulin, is helping to sending into cells, but the insulin is not sufficient and it is not opening because it is already eaten more. So the brain will say again, sugar levels are too high in your blood, now generate more insulin, so that it will open more knock, then it will open and it will enter. Agree? Till now there is no doubt. Now see the magic. So brain think it is an artificial intelligence, but brain does a small mistake that along with this insulin, in our body normally another hormone produces insulin growth factor. So what is insulin growth factor? That is a hormone. It helps in our growing in our height, our hair, our nails. All growths are happening because of insulin growth factor hormone. It should be developing as per our body. So what happened when this additional insulin is developing, secreting in our body, this IGF is also growing. But this IGF is like insulin like growth factor, not insulin growth factor, insulin like growth factor, IGF. What is it called? When it develops, if 30 units of insulin is developing in our body inside our pancreas, 30 units of IGF will also secreted. It means both are developing. This IGF is not required. So what happens? When this IGF develops inside our body, it's called cancer cells. When these cells are developed outside our body, overweight, obesity, thank God, if anyone has obesity, it means they have just escaped from cancer. Right? And there are a lot of things we can do to reduce obesity, but it is too difficult to reduce the cancer elements, cancer cells in our body. Yes, there are a lot of ways, but it is very easy to reduce obesity and cholesterol levels. That is why, as I told, your lifestyle is increasing your overweight. How these overweights are going towards obesity or cancer? You know that all these cancers are related to overweight only. Okay, and all the things, whatever problems, for example, these sugar levels are coating in your in your liver. It is called I think, if it is coating in your thyroid, it is called thyroiditis. Yeah. Then all the itis, right? Can you say some itis names? Itis, arthritis,
Bronchitis.
bronchitis. So arthritis means all the sugar coated are depositing on your what? Bones. So whatever itis is there is because of just depositing of additional sugars on that particular organ. Yeah. So cardiovascular disease, if it deposits in the chest, in our heart, cardiovascular diseases, bronchitis, all the itis are there because of this only. And one more secret, there is no direct medicine. There is no medicine has been discovered for curing all the itis problems. No medicine for direct medicine for arthritis, all the itis, bronchitis, appendicitis. No. Do you know the secret today? And
Yeah.
I just covered on the surface. I don't want to go deep in. You will not understand that in the day one. Okay. And in the next session, if you have patience, I will tell you the secrets of the calcium, which is damaging our body. How we are eating that? We are consuming daily milk, because of which we are damaging our body. I'll tell that secret in the next session. Please be there, because again it will go to another half an hour. Okay. And I hope you enjoy. I hope you opened your eyes. Please do that. Take care of your health. No one is going to take care of your health. No one is seeing these secrets. Everyone is there to grow their revenue. Everyone is there to, especially the hospitals, sir. You know that if you admit in the hospital, you have to come out after, maybe nowadays they're planning and they're improving their system to increase the operation levels. Yeah. So please take care.
In that case, for kids, we don't give milk. We give milk, right? How do we avoid that for kids?
Yeah,
Tricky.
I think we discussed this in last session. I think were you there? I think you were not there.
Yeah,
So I discussed this. I will tell you in the next session the secrets
yeah.
of milk, right? And what happens if we eat, how to avoid them. There is a procedure, and it will take some time to slowly cut down milk also. Okay,
Okay. Yeah.
but it is up to you. It is my way, my takeaway, what I learned, what I actually saw, and I'll tell you with the
What is
proof.
the substitute for the milk
Yeah,
if
yeah.
we are not
Milk,
using it?
milk substitutes are almond milk, coconut milk. These two
Oh,
are milk substitutes.
okay, got it. Okay. Yeah.
Yeah,
Okay.
almond milk and coconut milk.
Okay. Yeah.
But before that, please understand the chemistry. I'll tell you in the next session what is
Sure.
happening actually in our body with calcium, high calcium, how we are taking high calcium, how it is damaging our body. And no one is telling
Oh,
this, right? Has anyone told that stop drinking milk?
no, no.
No, right? And has anyone told that your lifestyle and only overweight is becoming cancer? And these cancers are, everyone is naming differently, right? Every cancer is different. There is nothing. If you control your lifestyle, no, everything is like on the floor. Everything controlled. Okay, super. I hope you came to know some of the things today. And Dinesh, you are attending since 1 year. Many people, Chandrasekhar and Rudresh, these are all guys attending every day. And Sonali also. Okay, look forward to see you in the next session. Until then, bye bye. See you. Take care. Jai Hind.
Thank you, Srinivasu.
Thank you.